Hello, I'm Dr. Maureen Craig, clinical nurse specialist and yoga teacher here at UC Davis Health. I am attending my own graduation today, so I'm sharing my presentation with you in this recording. If you have any questions about this presentation or want to talk with me about whole food plant-based eating for your patient population, your friends, family, or colleagues, please contact me at macraig@ucdavis.edu. Thank you. Eat your vegetables. I am sure you have heard your mother or another caring adult say these words to you somewhere in your lifetime. But is there any value to this adage? Meet Al. At 48, Al had his first heart attack, followed by a 5-vessel cabbage. He got religion and followed all the medical and dietary recommendations, yet his heart disease progressed. Despite medications and stents and a stair lift in his home, he was calling 911 for an ER visit for chest pain every month. He was sent to cardiac rehab, but not allowed to participate in the exercise because of his advanced heart disease, and told he only had a few months to live. They offered the whole food plant-based dietary instruction and recommended these books. Husselston's book showed that heart disease could reverse and coronary blood vessels could open up again. Al was convinced and decided to change his diet to 100% whole plants. Al's cholesterol and LDL were high. His kidney function was low. Could he gain any benefit from this change? Well, Campbell and colleagues reported a case of a man going on an exclusively low-fat, whole food plant-based diet and reversing his kidney disease and nearly doubling his GFR from stage 3 to normal kidney function. So there might be some hope for Al. Is Al's situation unique, or is this problem most of America will face in their lifetime? Let's zoom out and look at how big the dietary problem in the US is. Diet and lifestyle significantly impacts 9 out of 10 of our leading causes of death. Whether it be heart disease, cancer, or kidney disease, my favorite, the American diet is killing us. Despite all our attention on COVID, it only accounted for 10.4% of deaths, while the diet-related diseases accounted for nearly 60% of the deaths in 2020. Here you see in the State of the U.S. Health Report from 1990 to 2016 that the #1 risk factor for death in the U.S. is dietary risk, outranking tobacco and all other risk factors. We all know we are going to die, so why not die from a heart attack? Well, a better estimate of our losses is measured by DALYs, disability-adjusted life years. What is the number of years lost to disability or ill health? It turns out Americans lose nearly a decade of our life to disability related to what we are eating, and those years are where we are spending most of our healthcare dollars. My PICO question is, in CKD patients at UC Davis Health, what is the effect of a low-fat, whole food plant-based diet compared to standard care on the progression of chronic kidney disease, as this optimized dietary pattern works for all our most common lifestyle diseases? Time for my PubMed search. Before I get to my literature review, thank you to Matthew Grace for sharing our UC Davis population health data. This table is not comprehensive, but lets us see that the majority of people in our registry of 148,000 participants, just like all Americans, are suffering from conditions that are highly responsive to a whole food plant-based dietary intervention. Let's look more closely at the nearly 18,000 that have kidney disease and why we don't want them to progress to chronic kidney failure. So what typically happens in CKD and why is it so expensive? Specifically, we note that CKD progresses over time, fueled by underlying conditions like hypertension and diabetes, eventually leading to death or dialysis. Let's look at the cost of CKD care. Goldstan and colleagues unveiled how total all-cause costs increased exponentially as CKD progresses in both commercial and Medicare groups. And the story gets more interesting when Trish and colleagues reported in JAMA in 2021 that the average monthly healthcare spending for people with dialysis was $14,000 per month rather than $435. They noted that large dialysis organizations encourage patients to enroll in private insurance because it benefits their bottom line. Unfortunately, when private insurance companies have to pay these costs, they must shift the burden to all their members, making everyone's premiums more expensive. Have you noticed an increase in your healthcare costs? I began to think, if I could just keep one person off dialysis for 1 year, I would essentially cover my salaries. In August 2019, I had a male patient with diabetes referred to me to assist in transitioning to peritoneal dialysis in the next month. Being he was so near to kidney failure, I was not sure if this late intervention would be helpful. I presented the whole food plant-based diet as an adjunct to his medical care. He wanted to make the change and jumped fully in. He lost weight, his diabetes improved, he started dating instead of dialysis, and managed to stay off dialysis for an additional 2 years. Through my PubMed review of the literature, I became aware of more and more of the evidence that a whole food, plant-based dietary pattern could spare kidney function and improve overall health. When noting the levels of evidence, one might think that randomized controlled trials are superior to observational data. I'd like you to think again. You will notice the paucity of randomized controlled trials in the dietary arena, as people do not like being told what to eat for long periods of time, and dietary effects on heart disease, cancer, and kidney disease may take years to show. You might also find randomized controlled trials sponsored by the big meat, dairy, or sugar industry with results that attempt to question the benefits of eliminating those products. I wonder if there is any risk of bias. It is critical to look at who funded the research. Dr. Greger on his December 1st Nutrition Facts podcast notes that he has yet to find one published industry-sponsored nutrition study that finds an unfavorable outcome for the sponsors. Fortunately, in my search for evidence, there were several very large observational studies not sponsored by industry with N's in the tens of thousands observed over many years. You might even be part of these studies, like the Nurses' Health Study or the Healthcare Professional Study. These studies are about seeing relationships between what people reported eating and health outcomes over time for kidney disease and some of the precursors like diabetes and hypertension. Now, that's the kind of evidence I have more confidence in. Study after study pointed to the benefits of plant-based eating for optimal kidney health and optimal human health. And not a single article described any harm to human health from eating too many vegetables. In fact, in the National Health and Nutrition Examination Survey, looking at over 14,000 participants, for those with chronic kidney disease, there was no upper limit to the benefit from plant protein. The more plant protein they ate, the lower their risk for death. But processed plant food is another story. Satya and colleagues looked at the data from the hundreds of thousands of participants in the Nurses' Health Study and the Health Professional Study. In this study, they split the plant intake into healthy and unhealthy categories. Healthy was like things on the right, whole plant food. Unhealthy was processed plant food, like orange juice and French fries. They revealed the greater the intake of unhealthy plant food, the higher the risk for coronary heart disease, seen by the rising dashed gray line, and the higher the intake of the whole plant foods, the lower the risk for heart disease, seen by the falling solid red line. They then compared these plant foods to animal-based foods. What was surprising was to see that the unhealthy plant food increased one's risk for heart disease even more than animal foods. But notice the healthy plant foods. There is no upper limit to the benefit represented by the yellow dotted line. Notice the servings of animal foods and unhealthy plant foods ends around 10. But because healthy plant foods are also low in calories, people can eat many more servings of these in a day, gaining even more health benefits. With all this evidence, why won't more people eat this way? The truth is we live in a sea of processed food, pressing on each of us to eat the food that makes industry money, rather than the food that promotes our health. Not one of us wants to resist the tastes and smells of the food we have learned to love. What is the way forward to gain the health and reduced healthcare spending benefits from this evidence? We need a marketing genius. Is anyone willing to do this radical thing called plant-based eating? Yes, there is a group of people that are very open and often excited to hear this simple but powerful information. Those fearing death, disability, and those in pain. Based on my evidence-based project, I recommend that all clinicians caring for patients with lifestyle disease, and in particular kidney disease, become familiar with the evidence and present this option to their patients, pointing people to the evidence-based eating guide that is available to download and print for free on the Nutrition Facts website, providing sample menus and a traffic light food list. Patients must have their diet assessed and together with their healthcare providers set goals to improve their nutrition-related behaviors. In addition, we must develop and deliver classes explaining what a whole food plant-based dietary pattern is and what benefits it offers people. We must also offer another class format, which begins with a short topic presentation and has most of the class dedicated to answering questions and offering breakouts for fun, connection, and support as people navigate the challenge of change. Yes, people will have discouraging moments where the journey seems impossible. This is where we help them explore doable change and the power of habit formation, choosing one tiny habit, repeating the behavior, and growing from there. We must offer whole food, plant-based food choices throughout UC Davis Health. We also need celebration points along the way, offering whole food, plant-based samples and sharing individual success stories. Just look at these joyful before and after photos endorsing the plant-based life. Let's say we just got 1% of our 18,000 population health patients with kidney disease to drink the green smoothie and remain off dialysis for just 1 year. That would equal $8.3 million in reduced healthcare spending. Does what we eat really matter? We eat about 3 pounds of food each day. That's 1,000 pounds a year or 80,000 pounds of food in a lifetime. Food is not only our fuel, it is also the building block of our bodies and brains. We are what we eat. Each time we place something into our mouth, we get to choose between hyper-nourishing food and hyper-palatable food. Let's follow up on Al's story. We know in nephrology that kidney disease does not reverse. In fact, it only gets worse over time. Could Al prove us wrong? Al says anything worth doing is worth doing to wretched excess. In the 2 months following Al's change to a low-fat, whole food, plant-based diet that he reminds me he loves to eat, Al lost an unwanted 30 pounds. He went from constant chest pain to walking miles a day, sometimes at high elevations. He's off all these medications. He went from taking naps and falling down the stairs to energized. In fact, he recently drove himself in his own RV across America and continues to book vacations around the world. Al's cholesterol improved to less than 150 milligrams per deciliter, and his kidney function did too, going from a CKD stage 3 to normal. Remember Al's wisdom that anything worth doing is worth doing to wretched excess? As seen on the left, the average American eats only 12% whole natural plant food. Is it possible patients with chronic lifestyle disease may want extreme healing and be willing to embrace extreme diet change? Really, what is extreme? Surgery, dialysis, or a cold green smoothie? You might be thinking, could eating more plants benefit me? Here at UC Davis Health, the #1 reason people retire early is their health. Al had the money and time, and now he has the health to live vibrantly. Now, mothers won't be the only ones telling people to eat their vegetables. Healthcare providers will too. Look at all those appealing plant-based meals. Thank you to interest in my talk, I've been able to present this evidence at several unit-based practice councils, the Renal All Here Day and Nephrology Grand Rounds. I've had a few docs over for a plant-based dinner, have been getting referrals from the nephrologist to talk to patients about this eating pattern, have added whole food plant-based resources to my patient education material, and have saved more kidneys. Yay! I'm also coordinating with the transplant team to apply these findings to save donated kidneys as well. And I'm working on my lifestyle medication board certification. And I could use a helper. Are you interested? Have you been wondering if the whole food plant-based dietary approach is right for you, your patients, your friends, family, or colleagues? Please contact me at macraig@ucdavis.edu. Let's think it through together. Here's to our health and happiness in the holidays and beyond.